Welcome to the Transforming Assessment webinar series. Today is the 2nd of August. Today's session by Associate Professor Clair Palermo from Monash University is on competency-based assessment. So Claire, would you like to begin, please? You may progress the slides.
Thank you very much for the introduction, Matthew. Thanks everyone for joining us today, and I hope, through this webinar to give you a bit of a sense of what this concept of programmatic assessment is. So apologies for those who've heard about it, and I've taken a bit of a step back from my discipline to try and make this very transferable across other disciplines outside of health, which you'll notice is my background, and I'll tell you a little bit more about me in a minute, to allow you to think about how you might be able to apply it or strengthen what you're already doing in and around programmatic assessment. So I am an academic. I've been at Monash for many years, and particularly training and preparing dietitians for practice. So I have a new appointment with the new Monash Centre for Scholarship and Health Education, where my role is essentially around leadership in education research. And I came into this area of assessment quite naively, I guess. I didn't think it was the particular thing about teaching and learning that I loved. But way back in 2012, I was lucky enough to get an Australian Learning and Teaching Council grant with some of the key players in dietetics education across the country to really explore what was going on in and around assessment. And this revealed probably what you would find if you went to any of your respective disciplines, that what we were doing in and around assessment was very historically based, not particularly based on evidence, very restricted to what university rules and regulations allowed us to do, and didn't particularly align with where the new evidence was emerging around what we should be doing in and around assessment. And I was able to take that work forward and was fortunate enough to get an Office for Learning and Teaching Council grant, not a grant, a fellowship I should say, and was a fellow in 2014 moving into 2015, and I'd like to acknowledge what was Office for Learning and Teaching for that work, because while I'm not really presenting that work today, I guess I wouldn't understand programmatic approaches to assessment if it was not for that fellowship. So I guess I'm keen to hear a little bit about whether anyone has heard of programmatic assessment or are applying it. So perhaps we could have a show of ticks first as a starting point as to if anyone's heard of it before. So again, with the tick box that Matthew identified before. Great. So lots of people that have heard about it. Gosh, well I hope I can tell you something that I don't know. Is anyone, perhaps we can clear that, Matthew? Fantastic. Great to see you all interacting. Is anyone applying it or have fully integrated a program of assessment in any of their disciplines or their curriculum? Okay, so that's the sense, and look, that's actually the sense in the literature as well. So this is a very theoretical concept championed by one of the assessments gurus in medical education called Kees van der Vleuten, and was very much proposed as a framework or a theory or an idea, and certainly it has been taken up, but very slowly, and there are very few published examples in the literature on programmatic approaches. So I think that's the thing to say, that it's new, but it's absolutely, hopefully I can show you, is a really way to think about assessment going forward. So what I hope to do today is really share the concept with you, the theory with you, and then how you might apply it in practice. I purposefully didn't put any dietetics examples in, and I can point you in the direction of those resources if people are after them, but I didn't want to bore you with what a dietitian is required to do in practice. But you will see a bit of a health flavour through, so I'll apologise for that if anyone comes from other disciplines straight up. So perhaps now we can have a practice at using the chat button and ask you to type in anything that comes to mind when you hear the word programmatic approach to assessment. So you can see that. I agree. It's absolutely, as Fred, Matthew, it's about competency for sure. Thanks, Jeanette. It's coordinated. Yep. Something to do with technology. really important thing to think about in collating our assessment information: alignment, holistic view. Fantastic. Completely agree that it's all those things. So hopefully I can shed the light on what it is and how you might then apply it in your practice. So ultimately, the concept of a programmatic approach came from work that essentially came from the competency-based education system, or kind of concept of the way we do things, which I know you're all familiar with. And certainly in medicine, it was proposed that this is ideally what we should be working towards in and around when we're designing curriculum and assessment. So we should strive to get these graduate capabilities, or some professions have the concept of competency standards, and certainly in health, 90% of our disciplines have competency standards, which describe the major work roles, the skills, and the indicators that kind of guarantee the performance of a professional when they're in the workplace. And ideally, that these competency standards should be developed based on what the consumer of that profession actually needs and the system that they usually are employed in. And therefore, we're essentially meeting the needs of the community, of the population, with the workforce that we're developing. And then from the competency standards should clearly flow the curriculum and the assessment, and there should be clear alignment between these elements. And the other important thing to consider when we're thinking about programmatic assessment is the concept of competence, which someone mentioned is absolutely part of competency-based assessment. So what I'm defining competence as is this routine, considered use of communication, knowledge, technical skills, clinical reasoning, emotions, values and reflections that are applied to a practice problem with the aim of improving outcomes. So the clinical reasoning is obviously very health related, but the rest of that I'm sure you can relate to outside your own disciplines. And I was fortunate enough to meet Eric Hombo, who is leading much of the work in accreditation in the States, and stole his slide while I was at it. And he basically describes the fact that the Dreyfus model of skills acquisition talks about this kind of linear trajectory of novice to expert, but what we actually know that most trainees or most students will trajectory along that line very differently to competent. So a programmatic approach really is about trying to acknowledge that the development of competence is much more higgledy-piggledy, unpredictable, and is different for every different individual, not perhaps as linear as was sort of theoretically proposed by this model. So what is a programmatic approach to assessment? These are my kind of summary sort of points. They're not directly from any particular paper, but this is how I summarise what I think they're about. So the focus of the assessment is on the outcomes. So it removes any need for superfluous assessment that doesn't relate to the outcome. And I'm going to go through these each as individual points in a little bit as well. So it's assessment that looks at performance, or the things that are actually needed for employment. So the employability skills and the competency standards that I mentioned. It very clearly states what the standards are, and they're criterion referenced, which emphasises, I guess, that the whole focus of programmatic assessment is about progressing everyone through rather than trying to trip people up and fail half the cohort, which would be a norm reference kind of concept in assessment. It acknowledges that different trajectory of progress. Its feedback's fundamental, and that's related to obviously allowing students to improve and build that into the whole assessment program. And the learner is what needs to be at the centre of the whole program of assessment, rather than it being led or owned by academics or like. So as I said, I'll go through these in a little bit more detail. But first wanted to share with you Kees van der Gluten's model of programmatic assessment. So this was the manuscript that first described it. So you'll see that it's not that old. So as I said, it's a very new concept. So this, I'm going to spend some time on this slide because it's quite complex, and every time I still look at it, I learn something new about it. Let's first look at these training activities. So there's two parts to these, in that there are these learning tasks and the artifacts of learning, which are the larger boxes. So in essence, these are about the things that a student will do in their learning experience. So anything from a workshop, a lecture, a practical class, a case-based discussion, anything that leads to learning happening. And from that learning, it's expected that there be some artifact or some bit of evidence of that learning. The other thing that's in this illustration is the assessment activities. So the clear triangle represents any single piece of assessment. And it's represented as a triangle in cases illustration because it was meant to represent Miller's pyramid, and many of you may be familiar with that, which is the knows, hows, shows, does concept, focusing that assessment can be at all of those levels, and even in a program of assessment you might acknowledge that, you know, some knowing assessment is an important part of that program of assessment, as well as, you know, showing and doing, for example. And the ones that are in the clear boxes are the formative pieces of assessment, or all the assessment that essentially results in learning. So the link may be that as part of a learning activity there's an assessment result. So, you know, students may you know, do a case discussion together and then present back to the tutor, for example, what they learnt about that case. And in that case, there would be connection between the training and the assessment. These are all low stakes assessments, so assessment that is summative but may not necessarily present a high stakes assessment. Within this triangle system as well, there's also the blue triangle, and this is denoting sort of a particular assessment task that's kind of the crux, or maybe seen as perhaps a hurdle requirement that generally represents a mastery skill. So it's something that you can't kind of progress without this skill. It's fundamental to a judgment of progression through a program. And all of this assessment needs to be documented and collected to allow this intermediate evaluation to take place, which I'll talk about in a little while. The supporting activities are also fundamental to the program of assessment, and these essentially are about reflection. So students reflecting, having dialogue and social interaction around the learning that's occurred. So building very much on social constructivist theory of learning, where students, you know, internalise with their peers and reflect on what could be done better, but also to mentors, teachers, coaches, judges, etc. But this is part of the program. So there is also clear indication in this program of assessment that at points in time there needs to be intermediate evaluation. And at these points in time, they may be at the end of a semester, they might be at the end of a period of a semester, they might be at the end of a year. It's entirely up to the program of assessment. But at this point in time, all this information is looked at to make some kind of judgment or evaluation of a student's progress towards this next time period. So this approach is really taking into consideration this whole picture of learning and assessment to make an evaluation of student performance. I should have said first that this program of assessment could mean or could be designed for anything from a whole course to a subject, a unit, a topic, a placement program or a work-based learning experience. There is no you know, defined criteria at which it can be applied, and Certainly in the practice that I've had, we've applied it to concepts. So, you know, how do students come out being culturally competent, for example, and what's the whole program of learning and assessment that gets them to be that way, right through to thinking about our whole curriculum and thinking about, you know, all competency standards that dietitians may need to achieve. So you can apply it at all levels. So I guess what I'm encouraging there too is that if you don't have control over a whole curriculum, that you can really apply these concepts to your particular unit or subject and really get much more out of your assessment. The other thing that you build in, that's built into this model, is this final evaluation. And this is obviously the point at which you're making a decision about the learner or the student's abilities. What's beautiful about programmatic assessment is that this final evaluation shouldn't be a shock to the student, because they've had 2 lots of intermediate, or 3, or however many lots of intermediate evaluation to give them feedback on how their performance is at. So it's definitely not meant to be a shock, rather than what sometimes can happen with our current assessment approaches, where that final assessment is a bit of a shock to students. The idea with the final evaluation is that it's because it's, you know, a higher stake, that it's done by multiple people, and the judgments are obviously defensible based on all these elements in the program of assessment being credible and dependable pieces. So that is the illustration. I think in practice of applying it, that's a whole other story, which we'll get to. So at this point, are there any questions on the programmatic approach or comments? I'm going to pause for a minute, because I know when I'm on these webinars it takes me long enough to type the questions and sometimes the speaker moves on. So I'll pause for a few moments to allow anyone to ask a question. Yeah, you did right about that, Mathew. It does sound like what well-designed assessment should be like. And in theory, I think we all go, oh yeah, this all just makes sense to us. And it's obvious, but I think if we really unraveled what we did do, it's not particularly programmatic. Yeah, I think it's a really good point about the apprenticeship training, and it's certainly what we're hearing on the street, is that, you know, those that are employing our graduates are not getting what they want, and so there's some misalignment between that competence or that graduate capability and what employers are wanting, and this is really critical if we're really to have courses that, you know, our students want to come to. Reflection's a really good question, and I'll come to that in a little bit more time, Jill. It's absolutely as done on the HOC with other students, so with peers, but also as part of feedback. But really clearly in the model, it describes that reflection shouldn't be just for reflection's sake; that it needs to be purposive and really align with the experiences that have happened, the task, the feedback that the students had. I think that the really good point about being available to students and thinking that it could be overwhelming, we've had similar discussions at our level as well. I can say that when we kind of mapped all the assessment and sort of showed it to our students, while we haven't completed our program yet, we've kind of just highlighted the assessment bits, we're just kind of trying to work out how they all go together, is that it actually was quite the contrary. The students went, oh right, now I see why I'm doing all of these bits. Yes, it's overwhelming, but at the end of my degree I'm going to have done all these things, and that's how you're going to judge me as to whether I'm ready to enter the workforce. So we agree, we were concerned too, but when showing it to students it was quite enlightening. Yes. It's a really good point, Mathew, about wondering whether a tightly coupled assessment program will make contract cheating harder too. Yeah, I think that's a really good point. Maybe we can revisit that question at the end when I give you a little bit more, and you can help me answer that. All right, so let's move on. So let's unravel these concepts in a little bit more detail. So the focus on outcomes is clearly about the achieved competency standards, graduate capabilities, whatever it is that the outcome is that needs to be achieved. The assessment needs to obviously assess a broad range of capabilities and focus much more on the outcome rather than the process. So I think in our traditional approaches, we can get very caught up with how students are doing things rather than the product that they achieve in the end. So an example of this might be, someone in a work-based placement experience might be being supervised and a particular work-based assessor wants something done in a certain way when in fact there's probably 5 ways to get there. So it makes, it forces the assessment task to be designed on the outcome rather than the process, which can really unnerve students if they're being assessed on the process, because the process can vary and the standard, the expectations can change across different settings. So that's next concept about it looking at performance and application of knowledge and skills that are needed for employment. So this is really in and around all the literature that it currently exists around authenticity in assessment. So doing things that are actually done in practice. So not writing an essay, perhaps in a health profession's final year, final semester of practice when they really should be refining the skills that are needed to actually work as a healthcare practitioner. And maybe it's, it is a written task that needs to be done, but what is it specifically that is going to be much more related to employment versus just, meeting assessment tasks, setting assessment tasks for assessment's sake and meeting university type requirements. So as an example, we transformed, we had an essay in a public health unit, which was about an argumentative debate, which you'd all be familiar with, and this was sort of towards the end of our students' preparation, and after talking to sort of work-based assessors and the sector and thinking about the competency standards, we changed that it needed to be an advocacy piece where they were advocating to a minister or a local member or someone else about what needed to happen in and around a public health nutrition issue. So even subtle changes assessment just to tweak them to be more authentic is what's part of the program of assessment. And I mean, this is all built in with obviously our knowledge that assessment drives learning. And when you can engage students in showing them that the assessment is authentic, and this is something that is actually done in the workplace, they can engage in it even better. So the next concept is about having criterion-referenced assessment. So this is not about norm referencing, so it is about encouraging and having a system that supports every student to succeed. Now, that again sounds really obvious, and probably to the people in the room this is what you all aim to do, but there, as we all know, are academics out there that still aim for this bell-shaped curve and failing half the cohorts. But this is about a system, and programmatic approaches are about a system that supports everyone to get through. It also relies on these credible and valid and reliable assessment instruments that are part of that, and the people that are actually doing this judgment and the assessment need to be trained, they need to be experts, they need to be appropriately selected for that role. The next concept is around acknowledging this concept of differences in trajectories, and this comes back to that point, is that we can never judge performance or judge competence or judge a final assessment on any single assessment point, because it doesn't acknowledge that someone could be having a bad day on the day that that assessment is done. I always feel when I present this that feedback is way too far down the list. I should perhaps move it to the top. But clearly feedback fundamental to a programmatic approach. And I think what's beautiful about the programmatic approach is that it acknowledges that feedback comes from multiple sources. So it comes from the assessment tasks themselves and assessors it comes from peers, it comes from mentors, and that there's other people that are actually giving feedback to increase performance. The other key point about feedback is that the higher the stakes the assessment is, so obviously the final point of assessment, for example, obviously needs many more data points, many more bits of evidence about feedback and assessment outcomes to make a judgment. So the lower the stakes, the less points of feedback and assessment. And the last concept around learner responsibility and accountability is perhaps one of the most challenging, I think, to implement in a programmatic approach, but it's essentially about students taking ownership and responsibility for them gathering the evidence of all their assessment, acknowledging where it fits in their development, acknowledging what they're able to do well, what they're not doing so well in, making plans for the way forward, and taking charge, I guess, of the whole system. And I think this is potentially one of the most challenging things to implement in a system that is very much focused on academics and work-based assessors potentially making judgment decisions. So for those of you who have not been completely turned off by programmatic assessment, I'd also point you into the direction of CASE's 12 tips for programmatic assessment. So this is really, again, I guess a guide to help you think about how you might do programmatic assessment in your work. So I won't go through them in enormous detail, but essentially the master plan is about, what are the competency standards that you're trying to develop a program of assessment for? Is it the whole set of competency standards, or are you going to talk about one major work role or one key skill, for example? You need examination regulations that obviously promote feedback, including intermediate points of evaluation. And I think just want to emphasise that they don't need to be in the traditional ways that we often do intermediate evaluations, in the university setting, where that's typically at the end of a semester type evaluations, that they may be through semesters as well. You need in a programmatic approach a robust system for collecting all that information. You're probably thinking, how on earth would we do this? Lots of people jump straight to a portfolio or say, because they've got a portfolio for assessment, that they're doing a programmatic approach. But unless they've got all those other elements in it, it's not truly programmatic. But portfolios and electronic portfolios are absolutely a robust system, and that's where our technology that someone mentioned before can really come into play. The fourth tip is about assuring that every low-stakes assessment provides meaningful feedback, and this is about getting away from these pass-fail decisions and moving much more towards qualitative comments that give really clear, specific feedback about how learners and students can improve. Providing mentoring to learners, which facilitates the reflections. Ensuring trustworthy decision making, so ensuring that your assessors are trained, you have multiple people making decisions, it's not single individuals making decisions about students' progress all through the program, that there are immediate decision making opportunities through the assessment, so that students aren't left waiting on final outcomes. Making sure that remediation is tailored to the individual student, so that again it happens quickly, and that there are plans put in place for the student to either repeat the section of the program of assessment or be provided with the support they need to get through that one final mastery task, for example. To monitor and evaluate, which is part of any good process, I guess, to make sure that it's never set in stone, that it will continually evolve based on feedback about implementation. Ensure that it's used to create interaction between all the stakeholders involved, and that everyone understands what all the bits do and how it's all put together and what their component, I guess, does in terms of the bigger picture and the bigger program. And then obviously developing a strategy for implementation, which sounds like a fait accompli, but it's obviously the change management that's required to implement such a change to the way we think about assessment. So how do we do this? How do we create programs of assessment? So without kind of, unraveling competency standards from every profession that's out there or any graduate attributes of all universities, a way I like to think about this is to think about, well, okay, what is needed for a graduate of a degree to do a certain thing that they would do as part of that development that they've got in that degree. So, for example, what does a health professional need to know, need to be able to do to manage a patient with a chronic disease? What does a teacher need to know to be able to implement, to deliver a maths lesson to grade 2s? And similarly, what does an engineer need to know and be able to do to actually design structural steel for a new home? So I'm going back to my comfort zone here and using as an example, thinking about what does it actually take for a healthcare professional to provide an effective piece of care to a person with a chronic disease. So I would love people to give me their thoughts on what it actually takes. Think about the healthcare you may have delivered, someone with a chronic disease. If you want me to give it a label, let's think about type 2 diabetes. What does it actually take? What do they need to know? What do they need to be able to do? I'd love some thoughts. Yeah, absolutely. Problem solving, rapport, so with the patient, so being able to clearly communicate. They probably need to know something about diabetes as well. Knowledge of disease. Great, Trish, you were thinking exactly as I was. Understanding where the patient's coming from. Absolutely, all those things. Evidence of what are the most effective management solutions. Understanding what are the determinants of where they're coming from. And what might be impacting on that disease rather than just the biology, the physiology. What are the more psychosocial? What's the environment that person is coming from, and what might be contributing to their behaviours? What might be their barriers to change? So it's huge. Just the culture they're coming from. So you can see already how a programmatic approach can really put all these pieces together to develop an assessment program that allows us to make a judgment whether the graduate or the student can do this thing called providing effective care to a person with chronic disease. And what I loved about your responses is that, yes, we got to knowledge eventually, but, it was so much more about, the communication skills and, the rapport building skills that were the first things that came to people's minds. So it's kind of a working backwards exercise, and I have an example in a paper I've constructed. I'm more than happy to share it, but the diagram did not look good on the slide, so I've kind of tried to simplify it a little bit here. So if you like, you would start with this kind of outcome and then think about, okay, what are all the, clearly there's going to be a bunch of learning experiences that are going to be going on, but what are the key pieces of assessment that is going to give me evidence that this student can actually provide care that's effective to a person with chronic disease. So this is an example of a program of assessment, for example. So you might decide that this case study report is a key piece of evidence. They might do an exam around oral communication. There's clearly going to be multiple pieces of assessment based on how they're performing in the workplace with other patients. And obviously, this piece of assessment that starts getting put together, and then you make decisions about what might be mastery type skills. And in the case of nutrition, and I think lots of other healthcare professionals, this sort of oral, exam is one that is very much seen as a hurdle or a mastery, where students are really tested on that ability to have a conversation with a simulated patient. So it's very abstract, I know, and it's lacking detail, but I guess just to give you a sense of how you might start to construct a program of assessment going forward. So hopefully I've convinced you it's a good way to go. Now I really just want to shift the tone to talk about, the challenges, I guess, with implementing it. So, in the work that I've been doing in dietetics, we've had three examples of where people have taken this approach and implemented it for their work-based placement, and they've all taken a very different perspective. And again, for me, that's what has made me realise that this concept and this theory can be applied in so many different ways, and it's, you know, it's not like one size fits all. But obviously, stakeholders across all the settings in which you prepare your graduates for practice will have varying levels of buy-in and varying levels of resistance to change towards a new approach. So, you know, students themselves, the academic staff, if you do have a work-based placement, all of the stakeholders that are involved in that absolutely need to come on board the change, and as we all know, with change, those kind of things can be very difficult. The other major barrier that we came I guess, that was challenging to us was the university assessment policies and procedures. Things like how many words you need to have for a certain credit point subject, and how many pieces of assessment you needed to have, and, you know, the kind of typical structures of the way assessment was collated towards the end of a semester, and, you know, how you would actually manage an intermediate evaluation and how that would cross the whole unit. So the sort of the structural issues can be particularly challenging to work through when you're trying to implement a program of assessment. And on top of that, you know, also the structure of a course, you know, how many semesters has it got, when do you do the intermediate evaluation, when do you do the final evaluation, and what happens around course progression if, you know, a student doesn't get through an intermediate evaluation, and then, you know, all the rules that can come with that. So I think don't underestimate those system level factors that potentially can be very challenging in implementing programmatic assessment. I'll nearly at the end. Well, we're pretty much at the end. So I'll ask for some comments and questions soon around some of those challenges, or hopefully be able to give some insight if people have particular challenges. So I think, just in summary, I wanted to say that, you know, this programmatic approach, it's challenging, but it does offer a really fabulous way forward, I think, to really put the student in the centre of our learning experiences and the assessment, and them taking control of their development. It is focused on outcomes and authentic assessment. It's focusing on a holistic judgment rather than individual tasks. The criteria of those assessment tasks is linked back to capabilities and outcomes. It's longitudinal. There are multiple pieces of evidence, and the assessment evidence comes from multiple different stakeholders. Feedback is central, and that's feedback from assessors as well as peers, fellow students, and patients even, or students, if it's a teacher, for example, and the student is very much at the centre of that assessment. So at that point, there's plenty of time for questions, which I'm most happy to take now. And yes, I'm absolutely more than happy to link that paper on the recording page.
Hi folks, so I see people are typing in, that's good. And when those messages come through, I'm sure Claire will respond.
Yeah.
And what I want to do is just progress the slides by one. We've got on there as our feedback link that people can please fill in as we're going through the question and answers at the end here. So there's some messages, Claire, you might want to have a look at those.
Yeah, good, yeah. So everyone else can see those messages, can't they? So essentially about misalignment between what the competencies were and what the occupations were actually assessing. Is that what that means? When I went to industry, yeah, I mean, I agree. I think that we can overcomplicate things, and I think, you know, again, that's the challenge of working in an academic space where there are academic standards and we're training professionals which may have a different standard. You know, do students, all graduates, need to be able to write, you know, scientific literature? You know, you would argue some would hopefully be able to go on and do postgraduate research, but maybe that's not for everyone. So I agree there can sometimes be that. And completely agree, this assessment is much more interesting to mark. And what I think is really lovely about programmatic approaches is it really allows the students to buy into it, and it shows them how dedicated you are to their training and learning. So you present to them an illustration, and I can certainly also put my fellowship report links on the page too, Mathew, which gives the illustration that we sort of showed to the students that I was talking about before, where all the assessment was there. And they kind of, take it as, oh my goodness, you actually really think about this, how it's all put together, and it's not just their perception of this piecemeal effort and, kind of assessment for assessment's sake, that it's all very much thought about, linked to real life, linked to what they need to do in practice. So I'm just reading some more questions. Sorry about the silence. Yeah, I think assessment is a really challenging area, and I'm commenting, on the one about workload and assessment. And I think what a program of assessment allows you to do is manage those. So what we managed to do was, I think in the first kind of cut of our program, I think get rid of 4 pieces of assessment that what we identified were just duplication. So they're being assessed multiple times, not really a scaffolding of difficulty. So while there might have been a couple of tasks that were similar, there was a very clear scaffold of how it was a bit more basic in one, the first part of the longitudinal piece of assessment, and then it was built on later. But I think programmatic approaches really allows you to think about what is the most important pieces of assessment that allows us to make judgment, so it can really pull back workload, as long as your university allows you to do that with recommendations for word limits for certain credit point weightings, etc. But it can be quite enlightening and quite effective from a reducing workload perspective. I think the comment about the workload and how long it would take to complete the holistic assessment, I think what we've realised is that we're doing a lot of this anyway, and what the programmatic approach is allowing us to do is formalise that. So, many of you would probably come together with your colleagues at the end of a semester, potentially, if you're coordinating units, and discuss student performance. So that, that could be seen as a panel, or that, multiple people making judgments or looking at pieces of assessment. So it's not really necessarily about adding additional holistic pieces of assessment, but more formalising those and thinking about how they could even work more effectively to really deal with the goals and objectives of the program of assessment. Do all students respond favourably to programmatic approaches to assessment? Certainly, I have very few examples. I've got the 3 examples in dietetics at 3 other universities and my own university, Monash, and it is overwhelmingly positive from those 3 case examples that I know in intimate detail. The other thing that it seems to have been able to show is that students that traditionally would have taken a lot of time and perhaps were challenging to identify where their weaknesses were, what it seems to have done is completely flipped that, reduced the amount of burden on the academics that are trying to kind of get them through, but also enlighten them about how well they're progressing, how well they're doing, and what they need to do to improve. So certainly those very early examples would suggest that it's very positive. But I'm talking from one discipline with some pretty amazing people that have implemented these programs. And again, more than happy. They're at Wollongong and Canberra and Edith Cowan. So I'm more than happy to put you in touch with those academics if you want some more detailed about how they do that. Yeah, I completely agree about much more work going into the actual design of the assessment rather than actually the assessing of the tasks, for sure. definitely reduces duplication. Pleasure. Looks like we're at the end of questions, I think. Mathew?
Yep, so folks, you're welcome to stick around. If you could kindly fill in the feedback survey, that would be wonderful. I shall just paste the link into the text chat so that it will be clickable. If you could kindly fill that in, that helps us justify our existence for our bosses. So that would be great. There are some questions or maybe comments just popping in there, so we'll just keep the recording running for a couple of more minutes. If anybody would like to ask a question via the microphone, you're welcome to do that. Just put up your virtual hand using the little hands up symbol, and you'll be able to communicate with us via the microphone. We'll give you the mic. So that's also an interesting possibility.
I hope I got all the questions. I'm just going back through now.
There was one from Geoff Crisp. He said, do all students respond favourably to the programmatic approaches to assessment?
Yeah, I think I kind of touched on that in saying that in my minimum experience with the 3 programs that I've seen being implemented, it has gone very, very well. But that's my limited experience.
No, that's fine. Claire, if you can send me the links to those articles and your report, etc., I'll certainly stick them on the recording page for this session as well.
I can definitely do that.
Okay, so it does look like we're coming to a close. I'm not seeing too many more engaging questions. Okay, there's one from Janet. How students respond depends on the skills of the assessor when setting an assessment. Yes, that's probably a comment, yeah?
Yeah, it's a very good point. And I think this comes back to that whole buy-in. So what has been really wonderful to see is if everyone can understand everyone that has a stake in assessment at any level. So if it's one subject, one assessment task even, if they can understand the bigger picture of assessment and where their little piece of assessment sits in the spectrum of what we're actually trying to achieve, it can really empower those assessors. One of the examples that I think was most profound for us was in the work-based assessors. Work assessment is particularly challenging for a whole range of reasons that I won't go into and that many of you online probably understand. But I think work-based assessors find it very stressful. They really are very reluctant to fail students or give them constructive or negative feedback. Well, most, let's say. Some love that part of the job. Anyway, and when we've sort of started developing this program of assessment with our assessors and engaging them in the whole process, what showing them the programmatic approach has done has actually given this massive weight lifted off their shoulders, because they realise that their piece of assessment is only one part of a big jigsaw puzzle. And it has been really helpful in them seeing what their role is, how it fits in the bigger picture, and really making them feel much more relaxed about what their role is in assessment. And how did I get the work area to provide input? And what stage do you work with them? That's a really good question. I think change management is key, and I would say from the very beginning. So with my pieces of work that I guess is the fellowship as well as the piece of work that I did before that, we engaged every university that was teaching dietetics to kind of tell me about their approaches to assessment. And in the work that I did with Monash, absolutely involved every academic that had a stake and the work-based assessors in what I was doing from the beginning. And what now is delightful to see is that they are presenting on my, led work that they very much own and feel a part of as theirs. So I think that, to me, is testament that they get it too. So from the beginning, it's the message. Yeah, I'd love to see it implemented in education, Lisa. I think that's really where it could be called for and be a fabulous way to think about teacher development. So go for it. Let me know if I can help.
Okay, thanks folks. Actually, Lisa T, who's just sent you a message, will be presenting on her My Course Map software in the next next session. So there's some relationships between what we've been talking about today and the kinds of software that people like Lisa are developing for program mapping and things like that. So I think there's some synergies that can start to come together with these sorts of things too. So thank you very much, folks. I want to say thank you very much to Claire. It was a very interesting session. We've got some good discussion happening. But I'm going to stop the recording, and hopefully we'll see you here back at the actually at the end of the month on August 30th, because we're doing a slightly different schedule for the next session. So thank you very much, Claire.
Thank you very much, Mathew.
All right.
Bye, everyone.